So with the evening to our clinical instructor, I am John Thomas from BSN3-2 and I'll be performing the small volume enema. So for the first purpose is to relieve the constipation or fecal impaction of the patient, and also we have the second purpose is to prevent involuntary escape or of the fecal material to the surgical procedure or during the surgical procedure. We have also our third purpose in administering small enema or small volume enema or fleeting enema, that is to promote the visualization, promote visualization of the intestinal tract during the intestinal examination or procedure. And then after that, for our fourth and last procedure, that is for us, we are doing this procedure that is for us to help or to aid in establishing regular bowel movement, and then during our bowel training program. And then of course, after that, after we stated the procedure, is that we should proceed on the equipment, but before the assessment and the procedure itself. So for the equipment, of course, I like to quote precautionary measures on this one. Most of my materials were improvised or DIY. So for this return demonstration purposes, so I'll be using these materials. So since my materials are on Gimba, so I'm here on Cabanatuan, on my apartment. So what is our equipment to be used in small cleansing enema? That is the commercially prepared tip enema or with rectal tip. So it's just improvised. And then the water soluble lubricant. And then also also we have the waterproof pad, and then we have also bath towel or bath blanket, I should say. We also have our bed pad, our toilet tissue, our soap, our first is the disposable gloves, and then we have also additional PPE as indicated. We also have our paper towel or soap, of course, washcloth, soap, and towel itself. Okay, so there were missing materials. So for this return demonstration purposes, I'll just assume it, and I'll just be assuming that I just dried it, or I just assume that I just dumped it. Okay, so let's proceed to the assessment. So there were 4 assessments of this procedure. So after you clarify all the equipments, after you know what's the purpose of this procedure, of course, you proceed on the assessment. So ask for the last bowel of the patient. So, ma'am, kailan po ba kayo huling tumae? So the patient will answer us back. So since it is a doll, so it will not be answered as back. So assuming that it just answers. So we have to assess also the abdomen. We have to auscultate, percuss, and palpate. So I'll just percuss. I'll just also auscultate, assuming that I have a stethoscope here. Okay, and then also I have to palpate the abdomen. Okay, so also we have to assess for the rectal area for any fissures, hemorrhoids, tears, sores. Okay, so there are 4 things to remember there. So I'll just assess po yung ating fissures. Okay, there are no fissures, hemorrhoids, or any rectal abnormalities. And then also we have to assess for the laboratory work, so which assuming that I just have done that earlier. Okay. So, of course, in the procedure, let's not forget the alcohol. That is for the sake of our hand hygiene. So I will not be hand washing on this procedure, but rather I'll be just hand hygiene. Okay. So the procedure are as follows, or the actions that we will be undergoing towards the administration of small volume enema, or the flipping enema, or flip enema. Okay, so the first, of course, the first procedure that we will be going to do, that is to verify the order, or for the physician. Okay, we have to verify for the order of the physician. If the physician have any order for edema, we have to bring the necessary equipment. So just like we do earlier, so we have to check. Also, we have to bring it to the bedside table of the client. So because there's a rationale behind that. So to rationalize what we do, we put everything. We put everything on the table, of course. We do that. We verify also the order. That is because verifying the physician's order is for us to, it is important, it is vital for us to check the physician's order, for us to make sure that proper edema, or the administration, or the procedure is administered or done to the patient, to the right patient. So assuming that I have just checked the physician order before I came into the room and gathered everything on the equipment and such. Okay, so we have to bring all the equipment to the bedside table. Why? That is because, of course, we have to conserve the time and energy of our nurses, of course, or us. No? So we also have to arrange the items. So when we arrange all the items, so it saves the time for us nurses, and usually it prevents what we call the unnecessary, the twisting, the stretching of muscles that we needed for other patients as well. Okay, so after that, after that assessment is that, or after that procedure is that we will be proceeding on the next procedure, which is after we verify, after we rationalize. The first step is that we will now be proceeding on performing hand hygiene. So I'll just be using alcohol instead, and put on PPE if it is indicated. So assuming that I just put on PPE, and then because to rationalize this one, PPE and hand hygiene are ways used to prevent the spread of microorganisms, and our PPE is based on transmission precaution. Okay, so after that, after the second procedure is that we will now be proceeding on the third procedure of this assessment, which is after you verify, after you put everything, after you wash your hands, or after your hand hygiene. It is important for us also to take note that we have to identify. The patient. Of course, we have to identify the patient. So, good morning, ma'am. I am John Thomas from. I am a student nurse from the Western University of the Philippines. So, can I know po yung ating pangalan? Okay. So, assuming that the patient stated his or her name for me, and then in verifying or identifying the client, it also prevents us to have errors, or it also ensures that the right patient receives the right intended procedure. Okay? So, the second step for verification. No? Rather than having the verification from physician's order, so it is also a one way to check if our patients is right. So the step number 4 concludes us to closing. So assuming that I close the curtains, I close all the doors. So to the bedside table of the patient. So after I close everything, so so after we close everything, the room and the room, the curtains, the doors, so we have to explain what we're going to do, why is it necessary. So gagawin po natin sa inyo ngayon is magkakaroon po tayo ng enema. So small volume lang po to, ipapasok po sa puwet po, butas po ng puwet nyo. So yun po. Then, para po ma-avoid po natin yung constipation or kung meron man po tayong fecal impaction yung sa tae po natin para malinis po, no? Para matulungan din po tayo tumae. Then, we have to discuss where the patient will defecate. So, ma'am, pwede po tayong tumae mamaya kung if sa bedpan sa bathroom, commode, or anything else. So, pwede po tayong tumayo mamaya sa bathroom or pwede din po kayong mag-request kung hindi nyo po talaga kaya sa bedpan. Okay? So, to rationalize what I have just did and stated, that is to ensure, syempre, of course, the patient's privacy, of course, explanation, or, because we explained earlier, a while ago, because it reduces the patient's anxiety. And then also it increases the patient's cooperation all throughout the procedure. Of course, if the patient is familiar what you're going to do with the patient, of course, that is also better. It will be able for the patient to have a relaxation or peace of mind, and the patient will cooperate. Okay, so after that, rationalization, of course, when the patient knows, where he or she will defecate, of course, the patient also have know in everything in readiness when the urge to defecate. So usually the urge to defecate takes about 5 to 15 minutes. Okay? So of course the client will openly report to the nurse that oh, my urge is coming. So it's easier for the nurse to understand or to have this procedure. Okay? So after that, fourth procedure is that we will now be proceeding on our fifth procedure. So with the rationalization, of course. So for our fifth procedure, that is to adjust. We have to adjust the bed into a comfortable working height. So assuming that I have just adjusted this, and I've just adjusted these, and then of course we have to position patient into a left or to the left side of the patient. So this, so ma'am, position ko lang po kayo po like this, that specifically the same position. And then also we have to take note that if it is indicated by the patient's comfort and condition. So, okay lang po ba yung ganyan? So, the patient will answer. And then we have to fold the top linen here back just enough for the we have just enough for us to have access towards the patient's rectal area. Okay? So like that, we have to fold here, a little exposure as well as on the patient's gown. And then we have to place the waterproof pad under the patient's ring. Okay? There. And then, of course, having this, having the bed, or to rationalize this one, that is for us. That is for us to the proper working height, or the proper bed height. That is for the nurses to ensure the prevention of back and muscle strain. So we place this patient into a Sims position to allow the gravity to flow on the solution on the rectal area, or rectum and colon. And then after the solution of gravity flow and facilitate towards the direction, that is also for us to maximize the retention of the fluid or the solution we are going to insert towards the rectal area of the patient. And then, of course, what we did earlier is that we have to fold back, we have to maximize and cover all the patient's body surroundings, but left on the erectile area, because folding this manner will be able to help us to avoid any exposure, and also promote the patient's comfort, as well as warmth, and the waterproof, of course, the use of waterproof pad here, that is for us to prevent any spillage on the bed or protect the bed itself. Okay, so after that, we will now be proceeding on to the next procedure, which is after we did everything. Of course, we have to prepare for the solution or what we are going to inject, or we have to going to insert. So we have to put on the non-sterile gloves. And then after we put, because the rationale in doing so is that gloves prevent the contamination, or prevent the spread of microorganisms, as well as especially in handling these procedures, wherein we have to have contact with body fluids. Okay, so after we put on gloves, and after we rationalize this procedure, is that we will now be proceeding on step number 7, which is that we have to remove the cap. So this is just improvised, so you have to remove the cap generously, or for the lubricating, and then lubricate the end of the tube about 2 to 3 inches, or around 5 to 7 centimeter. Okay, so assuming that I am lubricating here, and then because this lubrication provides or facilitates the way of for us to have an easier access on the rectal end of the rectal tube, and then also through the anal sphincter. And then it also reduces the fact that we may have to injured or prevent injuries to the client, or to the mucosa of the client. Okay, so after we lubricated, okay, the client, is that we will now be proceeding on step number 8, which is we have to lift or we have to remember the position of the gland. So we have to lift the buttock. So just like this, lift the buttock, and then we have to expose the anus slowly and gently, inserting the enema tube for at least 4 to 7 inches. Okay, 4 to 7 inches, or in equivalence, or 3 to 4 inches, or in equivalent 7 to 10 centimeter. So we have to direct it. We have to have a perfect angle in inserting this on the umbilicus, okay, not the bladder. Okay, so we have to ask the patient to have a several deep breathing. So, ma'am, can you have a several deep breathing po? Hinga po tayo ng malalim ng ilang beses. Okay, I'll be inserting na po. Okay, we have to insert it gentle and slowly. So, assuming that I am inserting it, and then to rationalize it, this one, so we expose the anus. That is for us to provide the good visualization. That is also to prevent any injury on the tissues. So also for the anal canal, that is about 1 to 2 inches, or in equivalence of those, that is around 2.5 to 5 centimeter long. So remember that we have inserted slow and gentle. That is for us to provide the reduction of chances of the patient may have spasms of the intestinal wall, and also it may have sphincters, okay, for the intestinal wall. And then we also instructed the patient to have take deep breaths, several deep breaths a while ago. So this ensures us to relax the patient, or to have the patient's anal sphincters to relax. Okay. So after doing so, is that we will now be proceeding on the 9th procedure, or the 9th step of this procedure, wherein we have to compress. Okay, we have to compress the container. Okay? We have to compress the container with our hands, and then we have to roll the end up, just like this, on itself. Okay, just like this, and then towards the rectal tip. Okay, we have to administer. We have to make sure that we have to administer all the contents, fluids or solutions that is inside the container, and then we are doing this because, or to rationalize this one, we are rolling the container, of course, to administer all of its contents. Okay, and after that, we have to proceed to the next procedure, or the next step, which is the step 10th of this procedure. So because while holding, of course, the after that, the step number 10 enables us to state or do that after all the solution has been given. Okay, so we need to remove the tube, but keeping the container compressed. Okay, we have to remove the tube, and then we have to keep the container compressed. So I assume that there is a compressed container there, and then have the paper towel ready. Okay, assuming that this is a paper towel. And then we have to receive the tube as it is, okay? So here, so assuming that I have just done that, and then we have to promote towards the patient that the patient should hold the container that is still compressed until there's an need or the feeling or urge to defecate in especially when the urge is strong. So we have to wait, or specifically this usually takes at about 5 to 15 minutes, as I have mentioned a while ago. So to rationalize this one, the 5 to 15 minutes, the 5 to 15 minutes amount that we are expected to for the patient to urge defecation. Usually this is the time when the muscles are being contracted, and when this happens, the contraction resulted into a good productive results. Okay, so that is adequate to our expectations as well as the results. Okay, so after that one, we have to proceed on the step number 11. So for this step, what we're going to do is that we have to remove our gloves. We have to remove our gloves. And then we have to discard it, of course. And then we have to return, of course, the patient into a comfortable position. You have to make sure that the linens, okay, we have also to remove this waterproof pad and ensure that the linens are dry, of course, and are being protected by the waterproof pad. So, comfortable po ba kayo, ma'am? So, the patient will also answer. And I also covered all the should be covered to the patients. That is for us to provide comfort to the patient, and also the rationalization in doing so is that when we remove the gloves, is that we are helping in prevention of the spreading of microorganisms. Okay? And then few notes to remember, of course. Of course, after we remove our gloves, what we're going to do is to follow the step number 12, which is the, of course, we have to have, of course, before we have hand hygiene, we have to raise the side rails. Assuming that I raise the side rails and I lower the bedside, the bed height, or the height of the bed, of course. So I just done that a while ago. That is to elicit in the comfortable working position, and then also for the client also to have a comfort, and then also to rationalize this one, that is for us to have to provide clients safety and privacy as well as comfort. And then after we done all this procedure, is that in proceeding of the next procedure, with which is the step number 13, is that after we remove our gloves, we remove also our additional PPE if you wear it, or okay, so I'll just remove it, assuming that I wear additional PPE as indicated, and discarded to the proper trash or proper disposal. So we have to perform hand hygiene. So we remove because to rationalize this one, in removing and in disposing, discarding our PPEs properly. We also help not only by removing the contaminated gloves, we also help for the reduction or the prevention of the spread of microorganisms, and also for us to reduce the risk of transmission. Then, of course, we are doing this hand hygiene, of course, to prevent the transmission of microorganisms. So, or not only that, that is for us to prevent the spreading of infection and everything and such. And then, right after that, after we done hand hygiene, after we remove PPE, is that what we're going to do? Is that we will be proceeding on the step number 14. So, when this is notes to remember. So when our patient has a strong urge to defecate, so he or she will tell you, of course. So what we're going to do is we have to place the client in a sitting position, and then what we're going to do, so I'll just demonstrate it to you. So we have to place the client into a sitting position and on a bedpan. So here's our bedpan, improvised bedpan, or assist to the commode or the bathroom. So we have to place this by here. Okay. So also we can assist the patient if the patient refers going to the commode or bathroom. Okay. So we can also offer our available toilet tissues, and especially when the tissues are not to the level that can be reached by our patient. And then we have to be with the patient at all times, or we have ensured that there will be a call bell ready on the bedside of the patient, for the patient to have an easy access towards defecation, and the defecation is not prevented. And this position, sitting position, is the most natural position and helps in facilitating the defecation. So fall prevention is a high priority for us, of course. That's why we raise our side rails. We ensure the safety, because we help the client, or assist the client, because in the urgency of reaching the commode, okay? So because the client is already have urgency of defecation, so all things will be faster, quicker for the client, especially the movement or behavior of the client. So proceeding on to the step number 15. So we have to remind the patient not to we have to remind the patient not to flush. Okay, we have to remind the patient not to flush the commode before we inspect the results. So the results of administering enema. So because this gives us the results should be observed. Okay, so in proper observance, and in line of this, we should take that observation as our documentation, or we should write it down. So additional enemas will also be necessary, okay, or vital, especially if the physician have ordered or has ordered enemas, no, especially in the special quotation until clear. Okay, so in proceeding of our return demonstration, is that the step number 16 enables us to put on gloves in case of that happens, and assist the patient Okay, so if it is necessary, no, and then with cleaning materials or of the anal material or anal area and of the rectal tube area. So we have to assist in giving those washcloths, our soaps, okay, and also water. No? So that is for the purpose. So for hand washing. So also we have to remove gloves again, and then that is just for in case of that emergency happens or urgency happen to our patient. So to rationalize that one, we are doing this. That is because we are cleaning the anal area and also providing a hygiene that is appropriate in providing to the patient who have cleansing enema, enables us to prevent the spread of infections, microorganisms, bacteria, and also again gloves. In wearing the gloves, as I have said earlier, that is for us to prevent the spread of bacteria, risk for infection, and also gloves can be necessary for us to prevent the contact in with contact of body fluids. And then also for the step number 17, so whenever we leaving the patient, so we have to make sure that the patient is of course clean and comfortable. So in doing so is that we have to care. Of course, we have to discard the equipment properly. We have for the non-disposable and disposable ones, we have to return it properly. We have to clean it because bacteria can grow, or bacteria that grows on inside the intestine can spread not only on the intestinal area, not only on your hands, but it can spread all towards the equipment that you used towards all throughout the procedure if it is not cleaned properly. If all the sanitation, sterilization is not applied in an appropriate manner. Okay? So for the step number 18 is that we have again to perform hand hygiene, especially when we do that procedure, we assist, okay? In case of the urge defecation, we have to perform hand hygiene. Again, what's the purpose of hand hygiene? That is to prevent the spread of microorganisms, okay? So if there were any PPE that is indicated, so hand washing and PPE are ways to prevent the spread of microorganisms, and PPE is based on transmission precaution. So after that is that what we're going to do is proceed again to the step number 19. So in step number 19 is that we have to document the procedure. Okay? So we have to ensure that we have to document the procedure to provide a baseline for our physicians and the corresponding doctors of our patient. So I hope that you learned something from this recorded return demonstration. So again, I am John Tomas. Thank you for actively listening on my recording, and have a good night's sleep. Thank you.